Hello, my name is Cheryl Sim. I'll be your course instructor for this session. Thanks for joining us for part 2 of this Mid-Atlantic Panda Coalition course. Just as a reminder, part 1 covered child abuse and neglect. And just as a public service announcement for Maryland dental and dental hygiene professionals, you'll need to complete both parts to earn your 2 continuing education credits needed for license renewal. For other participants in other states and other regions, please check your state requirements for specific course content that you need for initial and perpetual license renewal. So just as a reminder, the Mid-Atlantic Panda Coalition, if you're new to hearing about this organization, it's a nonprofit organization that brings abuse and neglect education to dental professionals as well as individuals concerned about the increasing problem of family violence. So the Mid-Atlantic Panda Coalition is comprised of Maryland, Delaware, and Washington, D.C. as the coalition partners. So you'll hear me reference these states and the region of D.C. in terms of definitions, in terms of laws, but I do encourage you to check your individual states and regions for laws specific for you. So PANDA stands for Prevent Abuse and Neglect Through Dental Awareness. So the mission of PANDA is just really to create this community of professionals who are knowledgeable and interested in preventing abuse and neglect through the spectrum of victims in family violence. So the comprehensive course, again, is 2 parts. This is part 2. We're going to focus on the intimate partner violence victims, elder abuse and neglect, and human trafficking. So what we'll first address is intimate partner violence. So the Center for Disease Control defines intimate partner violence, and it's abbreviated IPV, as violence or aggression that occurs in a close relationship. The term intimate partner includes current and former spouses, dating partners. So intimate partner violence can vary in frequency and also in severity. It can be just one episode, but it can also be a series or a continuum of episodes that can have a lasting impact on the individual that's affected. It can be leading to chronic and severe types of health, financial, and well-being issues. So when we talk about the 4 types in intimate partner violence, we're talking about physical violence, which is when a person is hurt or tries to hurt a partner by hitting, kicking, or using another type of physical force. Sexual violence is the 2nd type, and that's forcing or attempting to force a partner to take part in a sex act. It can involve sexual touching or non-physical sexual events such as sexting, which is putting in sexual content into text when the partner does not or is not able to consent. Stalking is the 3rd type, where you have repeated unwanted attention and contact by a partner that causes fear or concern for the victim's own safety or the safety of someone close to them. And then the 4th type is psychological aggression, which is the use of verbal and nonverbal communication with the intent to harm the person and harm them either mentally or emotionally and exert control over that person. So intimate partner violence is associated with several risk factors, and it's connected to other forms of violence. And we are very, very concerned about the serious health and economic consequences that result. So how big is the problem? We're just going to be talking about the United States with these statistics. And we have to make sure that we don't neglect to talk about male victims. All the time we hear about female victims, and we a lot of times refer to the victim as she or her, but we need to also recognize that males are somewhat of the untold story. So in terms of who's experienced severe physical violence as a result of an intimate partner, when it comes to women, it's nearly 1 in 5. For men, it's 1 in 7. 1 in 5 women and 1 in 12 men have experienced sexual violence from an intimate partner. And 10% of women and 2% of men report having been stalked by an intimate partner. So violence is a very serious problem in the United States. Intimate partner violence is serious, and it is a preventable public health problem that's affecting millions of Americans. The term intimate partner violence describes the physical, sexual, or psychological harm by a current or a former partner or spouse. And we have to remember that this type of violence can occur in heterosexual couples as well as same-sex couples. And it doesn't require sexual intimacy. So the naming of this is a little bit disconcerting because it talks about intimate partner violence, but it does not require sexual intimacy. So these are the definitions, and as I said before, Maryland, Delaware, and Washington, D.C. are our coalition partners. And you can see that there's different definitions based on the different codes and family laws in these states and jurisdictions. They're slightly different, and they have lots of good things about the definitions, particularly Delaware's definition talks about specific types of intimate relationships, such as in marriage, dating, could be family, friends, or people who just cohabit together. Maryland's definition is quite good. It talks about the cycle of violence. DC's definition defines it as a criminal act. So each area or jurisdiction defines it differently, and there's strengths to each of those definitions. You'll want to make sure that you know the definition of intimate partner violence in the area that you live and work in. So what's the impact of intimate partner violence on individuals in the US? On average, 24 people per minute are victims of rape, physical violence, or stalking by an intimate partner in the United States. Assault accounts for the majority of all intimate partner violence crimes against women. The rates of violence among same-sex couples is very similar to that among heterosexual couples. However, there's not as much information known, and there's more research to be done in terms of same-sex couples. When one partner is exerting power and control over the other close partner in an abusive relationship, and I can't say this enough, the partnership doesn't require sexual intimacy to be considered IPV. So it can occur in any close relationship, and it doesn't have to be defined as partners who are sexually intimate. So how prevalent is it? About 41% of females and 14% of male intimate partner violence survivors in the US has experienced some form of physical injury during their lifetime. So let's say you were at work, and a lot of us are doing virtual work. So you might have a virtual meeting. Let's say there's 10 people in your virtual meeting. So of those 10 people, 3 out of 10 women and 1 in 10 men report one measured impact related to intimate partner violence. So what are those intimate partner violence measured impacts? One is symptoms of post-traumatic stress disorder. Second measured impact is being injured. Third measured impact is needing health care. And the fourth is needing legal and housing services. So again, think about 10 people that you might be in a room with, although now currently we're not in the room with that many people. This is really an amazing statistic to think that many people are and have been affected by intimate partner violence. We also need to consider adolescence. Adolescent dating violence is also a significant public health problem. So there's a growing body of evidence linking adolescent dating violence and re-victimization in young adulthood and in future intimate partner relationships. So we need to think about dating violence in this age of social media. Since we're not physically in spaces with groups of people, we also have to think, could the use of social media be used in negative relationship kind of text and whatnot? So about 10.3 of high school students report being hit, slapped, or physically hurt on purpose by a boyfriend or girlfriend. 53% of all female and nearly 48% of all male victims of intimate partner violence experience their first victimization before the age of 25. So dating violence can take place in person. As I said before, we need to also be aware of electronic sexting and inappropriate content in other types of social media that can be damaging to the victim of that type of problem. And we also need to consider that even if somebody witnesses or experiences violence in their home, that can impact that young person over a lifetime. And we're going to talk about the relationship between children witnessing violence in the home and intimate partner violence. So we also need to consider the startling statistics about female homicide. So female homicide is quite highly associated with intimate partner violence. It's also the leading cause of death among pregnant and postpartum women. And I'm going to be talking specifically about Maryland because I have a lot of data from Maryland. Most homicide cases in pregnant women were perpetrated by current or former intimate partners. And this is based on data from the Morbidity and Mortality Weekly Report. It's a report that came out in 2017 where they studied racial and ethnic differences in homicides among adult women and the role of intimate partner violence from 2003 to 2014. So we need to also look at who is affected by intimate partner violence. There really is no typical victim. It happens among people of all ages, all levels of income and education. As I said before, we need to talk about women and men as victims. It is very similar to child maltreatment in that intimate partner violence crosses all age, race, socioeconomic, and racial and ethnic boundaries. We do hear more about women. Women comprise between 85 to 90% of all victims. Men are often left out of the conversation, but we're trying to bring them back into the fold in this course because they are the untold story. We need to make sure that we're addressing their needs as well. So the rate of violence among same-sex couples, as I said before, is very similar to the heterosexual couples. What we find is that victims in this intimate partner violence situation oftentimes find themselves totally isolated from the outside world, often because they fear the perpetrator and what the perpetrator has threatened them to do or has actually implemented in the past. It's not really it's difficult to know how common intimate partner violence is because many cases are not reported. So when one partner exerts power and control over the other close partner in that abusive relationship, that isn't defined again by sexual intimacy. It's just that power and control exerted over one partner over the other. And, you know, we need to, again, not forget that males are part of this problem as well as the victims. The power and control wheel is often used to show that there are many spokes or many aspects of the power and control that an abuser holds over a victim. And this power and control wheel was developed about 35 years ago to explain the phenomenon of domestic violence. And so we hear mostly about physical and sexual assaults or threats to commit them. Those are the most apparent forms of intimate partner violence, but there are many other actions that can go along with or be separate from physical and sexual assaults. So it's any regular use of abusive behaviors by a perpetrator that may or may not be reinforced by physical violence that makes up this larger system of abuse. So some of the signs that we saw with child maltreatment, we also are going to see very similar things in the adult victims. A lot of times in physical violence, strangulation occurs quite often. And so in the dental environment, we would encounter a victim who might report trouble swallowing, maybe has had some voice changes, maybe has some contusions about the neck that would be indicative of somebody grabbing or choking them. And it's one of the reasons that choking is one of the screening questions that medical and dental providers could be asking their patients on a regular basis. So the dental team is in a good position to examine and identify injuries to the head and neck and throat region that are indicative of battery. And again, as I said before, strangulation is a primary sign of physical abuse in intimate partner violence. Some victims may exhibit extreme fear of laying back or being brought back in the dental chair because it reminds them of the vulnerability they experienced at the hands of the abuser, imposing his or her physical presence over the victim during those abusive situations. So intimate partner violence has many health and psychosocial impacts. So of course, the physical injuries can lead to chronic health problems. I talked about previously post-traumatic stress disorder being one of the measured impacts. We also have a number of folks that experience depression, anxiety, have attempted suicide, use substances, have mood disorders, sleep disturbances. As a result of traumatic injuries to the head, they might have visual disturbances that are with them long term. Other traumatic injuries to the head result in brain injuries, concussions, could relate to amnesia, confusion, and chronic headaches. And as I said before, another measured impact of intimate partner violence is needing legal and housing services. Chronic psychological stress may actually accelerate aging at a cellular level. So I'd like to take a little bit of time to explain where that's coming from. So one physiological response to chronic stress, and intimate partner violence is considered a chronic stressor, could result in changes to telomere length, which are useful markers of biologic age and thus could be a predictor of early morbidity and early mortality across many health problems. So a telomere are the little ends of the chromosome. And you can kind of think of the analogy of the little plastic tips on the end of shoelaces that protect the shoelace from shredding. Well, you can think about telomeres being the protective ends on DNA that protect our chromosomes from deteriorating. However, in stressful situations, again, intimate partner violence exposure is a stressful event, could shorten the telomeres and as a result trigger cell aging. So when we have an accumulation of these aging cells, it could reduce the normal function of these cells throughout the body. That could lead to chronic inflammation and other age-related diseases. So studies have found that formerly abused women have significantly shorter mean telomere length than women who had never been abused. In addition, it was found that being a mother and the length of time of being in an abusive relationship were the best predictors of telomere length. So this is really showing quite startling data that intimate partner violence can accelerate the aging process and associated age-related health problems. So it really does stand true that intimate partner violence does relate to chronic health problems, even with people who are no longer in those abusive situations. So as I said before, intimate partner violence has a really strong connection to pregnancy outcomes. Reproductive sabotage, coercion, and violence during and after pregnancy are common occurrences associated with intimate partner violence. So sexual and reproductive coercion are behaviors that interfere with a person's ability to control his or her reproductive life, which could be examples like intentionally exposing a partner to a sexually transmitted infection, attempting to impregnate a woman against her will, could be intentionally interfering with the couple's birth control, could be threatening or acting violent if a person doesn't comply with the perpetrator's wishes regarding contraception or the decision whether to terminate or continue with the pregnancy. As I said before, there are really strong correlations between child maltreatment and intimate partner violence. And as healthcare and social support professionals, we need to recognize that adult and child victims are often from the same family. So there's a growing awareness of the co-occurrence of IPV and child maltreatment. An estimated 3.3 to 10 million children a year are at risk for witnessing or being exposed to domestic violence, which can result in a range of emotional, psychological, health, and behavioral problems for children. It's actually been the subject of a long-term study. It's called the ACE study, the Adverse Childhood Experiences Study. It was research conducted by the Center for Disease Control in partnership with Kaiser Permanente over a period of 10 years, where they studied children who had experienced adverse childhood experience events in their early childhood, followed those children over years, and found that there were a whole host of psychosocial, health, and well-being issues for those children down the road. So even witnessing the abuse of a parent is considered an adverse childhood experience. The child didn't have to be the direct subject of the violence, but just witnessing in the home that type of violence created long-term adverse effects for that child. So families under stress produced children under stress. So if a spouse is being abused and there are children in the household, then the children are affected by the abuse. So children exposed to family violence are more likely to develop social, emotional, psychological, and behavioral problems than those not exposed to family violence. So here are the 10 ACE categories. And again, ACE stands for Adverse Childhood Experiences. And you'll see several that relate to direct mistreatment of the child, but others are just the child being in a home that's dysfunctional, just witnessing that the mother is being treated violently, or being in a home where someone is chronically depressed affects the child, or being in a home where one or no parents are present. Any one of these or combination of these relates to long-term effects for the child. So domestic violence does reach into the lives of children who experience it, and it affects their health throughout their lifetime. So it's not important to know the scoring system, but what's more important is to know that there are over 200 scientific articles that have been published as a result of this ACE study, looking at the long-term effects for very specific types of health problems that these children exposed to those adverse childhood experiences have encountered that have led to long-term health problems. So this ACE pyramid represents the conceptual framework for the ACE study. The ACE study has uncovered how adverse childhood experiences are strongly related to the development of risk factors for disease and well-being for that child over their lifetime. So studies have repeatedly found that a dose-response relationship between ACEs and negative health and well-being occur across the lifetime. So as the number of ACE factors, those 10 categories, increase, so does the risk for certain things such as the child developing alcoholism, abusing alcohol and other recreational drugs, having depression, having heart disease, liver disease, financial stress, attempting suicide, having adolescent pregnancy experiences. It's a whole host of long-term effects as a result of being in the category of one or several of those prior adverse childhood experiences. Bullying is something that we talk about over the course of this program, in that bullying is the use of force or coercion to abuse or intimidate others. It's behavior that can be habitual and involve an imbalance of social or physical power, including verbal harassment, threats, physical assaults directed against the victim. And it can be on the grounds of race, religion, gender, and just general ability of that individual. So there are ties between childhood exposures to domestic violence and involvement in bullying. Children learn by what they see their primary caregivers doing. So children who witness domestic violence are at a higher risk for becoming bullies or being a victim of a bully. So when children are bullied and they don't have any intervention or resolution by an adult, they end up learning that that's a normal relationship that people have with one another. So when nobody intervenes on their behalf, they learn that that's how people interact. And so what that means is that if a bully learns that there's no consequences as a result of these negative treatments of other children, and it could be their negative treatment as a child, then they learn that that behavior is okay in relationships, including relationships that they will have in the future with dating partners or spouses as they move into adulthood. And if the child is a bullying victim with no outside help, this child may grow up feeling that this is the best that they deserve, and they expect it in relationships. So it makes them more vulnerable to domestic violence later in life, meaning that they accept it because it is something that they've learned. They also might learn that they can do this through technology. So electronic aggression or cyberbullying is bullying that happens through email, chat rooms, texting, instant messages, or social media. And because everybody's at home now, people are using social media more, we need to look at the risk for children be exposed to this type of electronic aggression. So there are very strong ties between bullying and intimate partner violence. So parents are very powerful role models, and children will mimic the behaviors of their parents and caregivers and want to be just like them. So when parents engage in violence, children may assume that violence is the right thing to do, or the right way to do things. So as I mentioned before, bullying and intimate partner violence mirror each other. The motive is the same. The abuser in a bullying relationship, as in intimate partner violence aims to control and dominate the victim. And the bully abuser dehumanizes the victim. So when the bully or domestic violence abuser is allowed to damage others, the cycle of abuse is perpetuated to those observing it or directly experiencing it. So it really empowers the bully to continue without the fear of consequences. And we've found that this can also occur in all types of relationships, even in work settings. You can have a bully as an employer or a manager bullying a person in a subordinate type of role. And again, they are perpetuating it because they haven't had consequences for these actions. As I mentioned before, there's 3 basic screening questions that are used by medical professionals, and we need to be doing more of a part in dentistry to be asking these questions as well. It can be done in private. It needs to be done without any other person present. So it just needs to be the health provider and the patient. And you can introduce the topic such that make it so it's just something you do for every patient. You know, you can use a statement like, because violence is so common and help is available, I now ask every patient if they're being hurt by a current or former partner. You can also assure the patient that you're not going to tell anyone unless that adult victim gives you permission. So the 3 screening questions that are very effective: has your current or former partner threatened you or made you feel afraid? You can preface that by saying, had they stalked you, insulted you, threatened you with a weapon, threatened to hurt you or your children? And don't forget, threats against pets are also very effective control mechanisms of an abuser over a victim. Or is the abuser threatening to control who you talk to, where you go, and how you spend money? Second question, has your partner hit, choked, or physically hurt you? Hurt includes being hit, slapped, kicked, strangled, bitten, and shoved. And remember, strangulation is one of the primary mechanisms of physical violence and intimate partner violence. So it's key that it's one of the questions. And then third, has your partner made you have sex when you didn't want to? Those 3 basic questions are something that you can ask of all your patients, and just make it so it's very common and you ask it of all your patients. You're going to get one of 2 responses. If the patient discloses, let them know that it's not their fault, that help is available, and you have information if they would like it. So you're approaching them from the standpoint you want to help them, help is available, and it's not their fault. On the other spectrum, a response might be from the patient that they deny it. Even if it's so obvious to you, but they're not ready to disclose, your response is just that, I'm concerned, there's help available, and if you would like it, we have information that we can give you. That's the best that you can do for that person until they're ready to disclose. So as far as guidelines, you can document in your records just like you do for a child victim. However, very different from child victims of abuse and neglect, adults need to report on their own. You can always consult your law enforcement when you have a victim who denies it, but you know for sure that something's happening. You can call the police, but I don't want you to be alarmed if the law enforcement person tells you that they're not able to do anything until that victim self-reports. So again, check your state laws, but in most states, it's required that the adult victim reports on their own. You can also contact your local domestic violence programs for more information. They will likely tell you the same thing, that the adult needs to make the contact. And that's what's very hard and very different from child maltreatment. For child maltreatment, we can report without consent from anyone. We can just report, we're mandated. But for adults, the adult victim needs to self-report. Now, again, there's different laws in different states. Unless you're an expert on the law, you're not going to know all the little intricacies of your state and county jurisdictions. But in the case where you do not need the victim to consent, so when you have intimate partner violence in a home and a child is being abused, then you don't need consent of that adult victim to report that there's child abuse occurring. Okay, the other exception is when you have a vulnerable older adult, so a person who is not capable of taking care of their own health, medical, and mental responsibilities for basic needs. So it's not all people that are disabled, but it's anyone over the age of 18 who lacks the physical or mental capacity to provide for their own dental needs. You don't need their permission. The other caveat is if perhaps, and again, this is going to be based on certain jurisdictions. I'm just giving you an interesting one from Maryland. In certain counties, if there's an injury that you're treating the victim for that's a result of a gunshot or moving vessel, there's certain counties where you don't need the victim's consent. But then other counties, you would need the consent. So at the risk of not knowing all the details of the law, you can call law enforcement, tell them all the details, and they'll be able to advise you on the law. There's no harm in contacting them, but don't be alarmed if they say we can't follow through because this doesn't meet the requirements for reporting. But nevertheless, check with your law enforcement. Because Maryland is one of our coalition partners, I'm just showing you how easy it is to find resources in the different counties. There's 24 counties in Maryland, and each county has some type of service program for intimate partner violence for victim services. And it's very easy to find things on the web. So in your state, you want to look for resources as well, particularly in the county or the region in which you're practicing. So how can you help? As members of the dental team, there's an organization called the American Academy of Cosmetic Dentistry, and they have a program called Give Back a Smile. And that's where dentists who join, who are trying to help particularly women victims, female victims of intimate partner violence, who are survivors and are trying to regain the work and regain their confidence, but yet have some physical signs of abuse, particularly oral diseases, and perhaps they've had some fractured teeth, missing teeth that were the result of physical blows to the head region. There are dentists who join this program that provide dental care for these women. And there's certain caveats that the women have to have left that abusive relationship. They have to be working with a caseworker. And again, dentists can elect to be in this program. So there are things that you can do to help the victims and the survivors. You can have resources available. Oftentimes, a victim of intimate partner violence that's in an ongoing abusive relationship isn't able to get away from that abuser, even accompanied by that abuser to the dental appointment. So the only time that the abuser and the victim kind of separate would be when that victim might use the restroom. So that would be an ideal location to have your pamphlets, hotline cards that have some resources for the victim. More often than not, the victim isn't going to take those pamphlets and brochures, but they'll be able to memorize those hotline numbers when they're in the restroom by themselves. It's oftentimes the only way they can get away. What you don't want to do is you don't want to force literature on the victim for risk that the abuser might search the person's pockets, their belongings, and find those and perhaps retaliate against the victim for revealing the abusive situation. So don't slip it in their pocket or their pocketbook or whatnot. They need to volunteer to take the materials, or at best let them know that there's some materials in the restroom that they can utilize when they're ready to leave that abusive situation. And then as an office, discuss the protocol for when you encounter a victim and how you can advocate for victims. This is a great time period to kind of take a look at reviewing some of the information. So I have a poll that I'm going to have you go ahead and answer this question if you can. Which of the following is an exception where the dental professional does not need the victim of intimate partner violence to consent to a report being made about their situation? And I see you're fast and furiously providing your responses. I'll give you a little bit of time to kind of read that over. So again, when you do not need the victim's consent. Okay, I'm just going to end the poll right there. And the results. So all of the above were the exceptions. So remember, in the case of a child being involved, you do not need to ask for the adult victim's permission. If you have a vulnerable adult in this situation, you also do not need to ask permission from that vulnerable adult to report. And then again, there's certain little caveats in the laws. And again, you don't have to be an expert in the law. Consult with your law enforcement agency for certain things that might occur that you might not be aware of. But in this particular case, as a healthcare provider treating an intimate partner victim that had an injury caused by a lethal weapon or an auto accident in Talbot County, which is a specific county in Maryland, then you must report it to law enforcement. So there's little things that you may or may not know. At the risk, contact your law enforcement. But again, the first three are things that you would not need to get permission from the adult victim. Okay, good job on that. Okay, so we're going to move into the next segment of this program, which is elder abuse and neglect. So elder abuse is the physical injury or neglect inflicted on an older adult person. Physical abuse is the use of force that results in bodily injury, pain, or emotional stress. Neglect is the failure to provide for the basic necessities such as food, clothing, water, shelter, medicine, dental care, and personal hygiene of that adult victim. So there's a National Center on Elder Abuse who provides a pretty comprehensive definition, and they identify that this can be perpetrated by someone who has a special relationship with the elder, and most often it's a spouse or the child of the victim. It can also be a sibling of the victim, a friend, or a caregiver. And then we also have institutional type of elder abuse, which is not as common as the domestic elder abuse, which is perpetrated by a close family member or non-paid person who's caring for that elderly person. So in an institutional case of elder abuse, it would be in a residential facility, such as a nursing home, long-term care facility, foster home, or group home. So elder abuse is a significant public health problem. 1 out of every 10 people age 60 and older who live at home experience elder abuse, neglect, and or financial exploitation. So these are the different types of elder abuse: physical abuse, emotional, psychological abuse, neglect, abandonment, which is leaving that senior citizen alone, sexual abuse, which could be a caregiver forcing an older adult to watch or be a part of sexual acts, and then financial abuse, theft or embezzlement of money or any property from that elderly person. So these are some of the facts surrounding elder abuse. Again, it can occur in institutions, but that's less common than elder abuse occurring in the family home. So it's often a well-kept family secret. In the domestic setting, it can be in the older person's home, or it can be that older person is living in the home of a caregiver. So one study estimated that 1 in 14 cases of abuse are reported to the authorities. So again, it's that well-hidden family secret. A lot of times, elder abuse victims don't want to report that their family member is abusing or neglecting them. So risk factors for elder abuse often occur when that victim is dependent on the abuser. Sometimes the abuser makes that elder person feel worthless because of their age, their gender, or their overall burden to the family member. So physical indicators are very similar as we see physical indicators of abuse and neglect in adults and children. Can be unexplained bruises, burns, pinch or bite marks or scarring. The person can look like they're unhygienic, they look messy, they have unwashed hair or soiled clothes. For people who are bedridden, the older adults might develop bed sores or other preventable conditions. And there was a case in my county that was reported last week where a son had been neglecting his older adult vulnerable father, and his father was in his 90s. The elder was bedridden and wasn't able to attend to his own daily needs. And when they discovered the elder, they actually had to cut him loose from his bed sheets because he had been laying in the bed for an extended period of time, been laying in his own urine and his own feces. He had bed sores that were open and oozing, and the sheets were actually stuck to him, so they had to cut him off of his bed sheets. And they actually, the report last week is that they found the son guilty of elder neglect. So emotional indicators would be in our elders who no longer find joy in the things that they used to do. And when we find that there's changes in their alertness for which we don't have any medical reason for these changes. We also need to be aware that some elders who are living on their own may be neglecting their self. So sometimes it's a concerned neighbor who notices that that elderly person isn't getting out, might go for a visit and might notice some changes in that person's ability to care for themselves. So that neighbor, that Good Samaritan, might contact the elder abuse hotline to talk about some of the things that they're seeing. And again, elders oftentimes are afraid to report, particularly when it's a family member that's doing the abuse and neglect to this elder person. They may be in denial and not want to admit that it's their spouse or their wonderful child who is not taking care of him or her. So it's oftentimes unreported. And just as a reminder, a vulnerable adult is any adult who lacks physical or mental capacity to provide for their own daily needs. And remember that age is not a defining factor in identifying a vulnerable adult. So not all elderly adults are vulnerable, and not all vulnerable adults are elderly. So an elderly person, just like your adult victims of IPV, must consent to the call. Again, the caveat, unless they're vulnerable, but not all older adults, because of their age, are considered vulnerable. You want to contact the local police or emergency number 911 if there's a life-threatening situation or if the older adult you fear is in immediate danger. You can contact your local Department of Social Services. Their Adult Protective Services Agency will be able to advise you, but don't be surprised if they say they need to hear from that adult victim. So this is another great opportunity to kind of review what we just learned about our elderly and vulnerable adults. And let me launch that. Okay, so who is considered a vulnerable adult? An adult over the age of 75, an adult victim of intimate partner violence, an adult age 18 or older lacking the physical or mental capacity to provide for his or her own daily needs, or any adult over age 18 with special needs. So let's see how you respond to this question. Okay, I'm just going to stop it there in the poll. Let me share the results with you. So, an adult age 18 or older, lacking the physical or mental capacity to provide for his or her own daily needs, is considered a vulnerable adult. So again, an older adult, just because of their age, doesn't make them vulnerable. And an adult victim of IPV, again, isn't necessarily a vulnerable adult. And a person who has special needs or disability who happens to be over the age 18 doesn't automatically make them vulnerable. We have many disabled persons who were quite capable of caring for their own physical and mental needs and care for their own daily needs. Okay, our last segment of this program is human trafficking. And human trafficking is a crime that knows no age, ethnicity, geography, education, or socioeconomic boundaries. So the Trafficking Protection Act of 2000 defines sex and labor trafficking in the United States as sex trafficking whereby a victim is induced by force, fraud, or coercion into a commercial sex act. And it's the recruitment, harboring, transporting, or supplying or obtaining a person for labor or services through the use of force, fraud, or coercion for the purpose of involuntary service, bondage, or slavery. So victims of human trafficking are commonly trafficked into forced labor, forced commercial sex acts, and domestic servitude. Now, in the United States, we don't talk about organ trafficking as much as other countries. So in the US, human trafficking is really referring to labor or commercial sex trafficking. And that also includes Canada as well. But organ trafficking is the illegal trafficking of organs, like selling a person's organs to another person illegally. The transplantation of healthy organs into persons whose own organs have failed improves and saves thousands of lives every year. However, the demand for organs has outstripped the supply, and so it's created this underground market for illicitly obtained organs. But in the US, the definition of trafficking just refers to sex and labor trafficking at this point. So people are bought and sold and traded. Human trafficking is one of the 3 most profitable criminal activities in the world, which also include drug and arms trafficking, which is weapons. It's a multi-million-dollar growth industry. What's different about human trafficking compared to drugs and trafficking weapons is that humans can be recycled and used, bought and sold over and over again. So it's very profitable versus drugs get used up by the people that are using them after they're sold, and weapons get used up as well, but humans are recycled. So it's a very profitable multi-billion-dollar illegal trade industry. So are you recognizing all the signs of human trafficking? Typically, trafficking victims need numerous types of emergency and long-term services. And that might be dental care, medical care, substance abuse, mental health services, to name just a few. So are you able to spot all the signs? What we do know is that traffickers prey on individuals through very elaborate recruitment and control mechanisms. They can recognize an individual who has vulnerability, and that's why this crosses all the race, age, socioeconomic education levels. Anyone with a vulnerability can be a target for a trafficker. So a person who runs away from home is an easy target. A person who doesn't seem like they belong, they seem separated from their social and family contacts, they're a prime target for traffickers. And just to talk about sex trafficking, the United States is a huge destination site for human trafficking. And again, it generates billions of dollars for traffickers every year. The victims can be any type of victim: young children, teenagers, adults, can be male and females. And again, it's anyone who has a vulnerability that a trafficker preys on, and how that trafficker exploits that vulnerability. The trafficker might use violence, manipulation, make false promises to the victim, perhaps promising them a well-paying job or a romantic relationship to lure that victim into a trafficking situation. Unfortunately, young children are prime targets for trafficking because they're assumed to be easier for the trafficker to control. On average, a victim of human trafficking has 4 to 8 years of exploitation at the hands of the trafficker before they're rescued or able to escape or die as a result of the trafficking situation. So these sex trafficking situations can occur in a lot of venues, including fake massage businesses, through escort services, in residential brothels, on the street, truck stops, hotels, and motels, a variety of locations. And as I said before, the social media is a prime target for ways that abusers and traffickers or abusers can locate victims and make false promises of love and attention, promises of jobs and whatnot to gain the trust of that trafficked victim. Trafficked victims often work in legitimate businesses as well as underground markets. They can be people that are out in plain sight that we may not be recognizing. We hear a lot about human trafficking in massage parlors, but there could be trafficked victims who were working in beauty salons, in nail salons, and other types of health service industries. The victims are controlled through physical beatings, through deprivation of food, confined, and some of these victims are even tattooed. They're branded with the identity of the trafficker to indicate that they belong. They're under the ownership of that trafficker. And there's different ways that the trafficker controls the victim. They might control them through debt bondage, that in order to gain the gainful employment, they had to allocate so much money that they had to pay to the trafficker, and it becomes a cycle where they're never going to be able to pay back that trafficker. There's a lot of psychological manipulation that occurs, a lot of false promises, and the Stockholm syndrome is where victims often start to sympathize with the trafficker as that form of manipulation of the trafficker over that abused victim to make that victim not trust anyone else except for that trafficker. Oftentimes, the trafficker controls the victim's goings and coming and goings. They control their money. They oftentimes, again, are responsible for their food, their medical attention and whatnot. They're really under the control of that trafficker. And these are the red flags to look at. A person who seems to be overly controlled by someone else, such that they're very fearful, kind of depressed around that trafficker. The person might not know where they are or where they've been, so they seem kind of disoriented to time and place. They don't know even what state they're in. They may show some signs of physical abuse. And for a young person, they might be in the presence of somebody that seems much older and very controlling of everything that they do. They might appear malnourished, and they might show signs of addiction. And as I said before, they might show tattoo ownership by that trafficker. So additional red flags is when the person accompanying the victim speaks for that victim, doesn't let you talk to the patient on their own, won't let that victim out of their sight, won't let you provide the necessary medical and dental attention for that person, especially won't let you photograph signs of abuse. But in dentistry, it's very key, a red flag, where they only want cosmetic treatment for that victim, not health remedies. They're not looking at the health and well-being. They just want that person to be resellable and presentable, and they may not be looking at the health and well-being of that individual, just cosmetic types of services. So almost anyone can be a victim if they have a vulnerability. Possible signs of a victim is when that person is living in cramped quarters. They might be living in the same place that they're working. They might be overly dependent on that third person for their medical and dental decisions. They might not be able to tell you their future plans, and they might not be able to tell you about anything they do for fun or social contacts that they have with family or friends. So the same thing with an adult victim of violence is you want that individual to make their own report. Tell them about the human trafficking helpline. There's a text helpline as well. It's called the Be Free text line. They need to report themselves. If they don't want you to intervene, then you need to stop. Okay, you need to back away. Don't offer them shelter. It could make their situation worse. That victim needs to report themselves. And again, I talked about tattooing and signs of abuse that the trafficker holds over that individual. It could be branding and whatnot. Very young children are the targets. The younger the child, the easier they are to control, and traffickers locate victims very quickly. On average, a runaway child would be approached by a pimp within 72 hours of being displaced or separated from their home. What happens to these children is devastating. Over time, they become addicted to drugs, physically and mentally abused, and again, it could be 4 to 8 years of a time period of them being under the control of the victim. There are different things that you can do to ask questions. Ask for the victim's ID. Can they produce or access their ID? When was the last time they had a medical or dental checkup? Have they been in contact with their family? Do they have freedom of movement? Do they have knowledge of access to basic health needs and nutritional needs? What did they have for breakfast, lunch, or dinner over the past couple of days? If they have difficulty telling you that, that's a possible red flag. Have they been in Maryland for long? Do they even know they're in the state or region? What do they do for fun? Do they have a social network? Are they planning to go to school? Do they have a job? You know, you're trying to find out if there's a sense of fulfillment or a sense of hopelessness among these individuals. As always, you want to document your findings. describe what you see, transcribe all your data. If you happen to see the victim leaving in a vehicle, did you capture the license plate and description of the vehicle? And the truth and reality is that probably we're encountering more of these victims than we're actually able to identify. So make sure you know that the red flags, when a perpetrator of trafficking pays cash for care and cares more about the aesthetics for the victim than the health of the victim, that's a red flag. And know the National Human Trafficking Hotline and the Be Free text hotline to be able to provide for those victims to report. And if in doubt, you can call 911, but they're going to refer you to this human trafficking hotline. And in our state, Maryland is known as a gold mine for human trafficking because we're considered kind of a thoroughfare for connecting multiple states and cities. Rest stops and truck stops are primary locations for trafficking. And so there are various laws and ways that Maryland has tried to implement some successful programs to help increase the reporting. There's actually the National Human Trafficking Resource Center suggests that about 70% of human trafficking incidents in Maryland occur at truck stops. And there are various human trafficking reports in Maryland, as well as probably your states as well. And I'm just going to jump ahead a little bit to our final polling question, which is about human trafficking. And human trafficking victims should be encouraged to self-report to the National Human Trafficking Resource Center, Crisis Hotline, or Be Free text line, should be harbored in the homes or workplaces of dental professionals to keep them safe, may not identify that they are victims of human trafficking, or usually carry large amounts of cash to pay for their own treatment. And looks like you did quite well in picking A and C as the correct answer. Wonderful. And know that you can make a huge difference by knowing the resources available for human trafficking victims. I'm not going to go into many of the details about Maryland resources, but there are some resources that are in place. I'm sure there's multiple resources in place in your counties that you can explore for victims of human trafficking. I thank you so much for your attentiveness for the Mid-Atlantic Panda course. This is our website if you want to go onto that site to look for more resources. And I just want to acknowledge some of the important parties that have made this program possible. There's a question from Darcy. I'm a registered dental assistant. If a situation arises where I need to do a report, do I have to make my dentist boss knowledgeable before a report? And again, in reference to intimate partner violence, the adult victim needs to make a report. How do we define negligence? Negligence would be a person who is not being cared for in terms of their basic needs, such as health, shelter, food, receiving medical attention, could be their medications. And would those screening questions work for somebody being emotionally abused? It would be a workable, especially for the first question, when you're asking the victim if they have been hurt in any way by an intimate partner. And it doesn't have to be just physical violence or sexual violence. So any type of hurt perpetrated by an intimate partner against another partner. Elderly people often have unexplained bruises. How do we tell the difference? Well, simple is just to ask that elderly person, how did they get the bruises? And does their answer and their history match the clinical presentation? There are some signs where a person is grabbed and bruised, and you can actually see finger marks left by the perpetrator. Burns can also be like tattoo marks left by an implement that's used to burn that individual. So is there any hesitation of that elderly person providing answers to your questions, and do their answers match up to what you're seeing clinically? I would love to answer all these wonderful questions, but I've gone a little bit over time. And so I'll answer one more. Is incest considered intimate partner violence? So incest relating, if a child's involved and a family member is sexually abusing them, that falls under child maltreatment. And so you can report without any authorization from any of the family members. When a child's involved, that throws out all the rules of the adult victim needing to consent. When a child is involved, all the rules are thrown out. You can report without any consent from anybody, in that family situation.